Hi everyone, my name is Jeremy Carcero with my group mates Titsu Sintina and Lawrence Kamama from BSN2C, and we are going to podcasting the importance and uses of Methimazole meds. So first, what is the purpose of podcast? A podcast has the potential to inform, inspire, or engage its audience. Ultimately, a podcast is a way to share content. While some enjoy reading articles, others prefer something they can listen to. Podcasting is flexible, and podcaster can use the medium in many ways. People might listen to a podcast to learn more about the topic, keep up with a current event, or because they want to laugh. A podcast can also be a powerful marketing tool. Podcasting can be an opportunity to promote your business, broaden your reach, or market to your existing audience. Podcasts offer efficient learning that is quick and concise and straight to the point. Podcasts make it easier for them to find time to study. A common attitudinal change from listening to medical education, podcast is a reported sense of community. So, Thiamazole, also known as Methimazole, is a medication used to treat hyperthyroidism. This includes Graves' disease, toxic multinodular goiter, and thyrotoxic crisis. It is taken by mouth. Fall effects may take a few weeks to occur. The importance of Methimazole, a thionamide medication. Without thyroid hormone, your body cannot function properly, which may result in poor growth, slow speech, lack of energy, excessive tiredness, constipation, weight gain, hair loss, dry thick skin, increased sensitivity to cold, joint and muscle pain, heavy or irregular menstrual periods, and depression. Methimazole is used to treat hyperthyroidism, a condition where the thyroid gland produces too much thyroid hormone. It is also used before thyroid surgery or radioactive iodine treatment. Methimazole is an anti-thyroid medicine. It works by making it harder for the body to make thyroid hormone. Methimazole is a thionamide anti-thyroid agents that inhibits the action of thyroid peroxidase, leading to a reduction in thyroid hormone synthesis and amelioration of hyperthyroidism. So the brand name of Methimazole is Tapazole, and generic name is Methimazole. In the United States, Methimazole is indicated for the treatment of hyperthyroidism in patients with Graves' disease or toxic multinodular goiter, for whom thyroidectomy or radioactive iodine therapy are not appropriate treatment options. Methimazole is also indicated for the amelioration of hyperthyroid symptoms in preparation for thyroidectomy or radioactive iodine therapy. In Canada, Methimazole carries the above indication and is also indicated for the medical treatment of hyperthyroidism regardless of other available treatment option. So, Methimazole is a member of class of imidazoles that eat imidazole 2-thion, in which a methyl group replaces the hydrogen. So, Methimazole is a member of the class of imidazoles that is imidazole 2-thion, in which a methyl group replaces the hydrogen, which is attached to a nitrogen. It has a role as an anti-thyroid drug. Methimazole is a thionamide anti-thyroid agent that inhibits the synthesis of thyroid hormones. The synthesis of thyroid hormones, thyroid is in a class of medication called thyroid agents. It works by supplying the thyroid hormones normally produced by the body. In a weight basis, Methimazole is 10 times more potent than the other major anti-thyroid thionamide used in North America. Propyltyrosine and is the active metabolite of the prodrug carbimazole, which is anti-thyroid medication used in the United Kingdom and parts of the former British Commonwealth. Traditionally, methimazole has been preferentially used over the propylthiouracil due to the risk of fulminant hepatotoxicity carried by the latter. With propylthiouracil being prepared in pregnancy due to the perceived low risk of teratogenic effects. This peak documented teratogenic effects in its published labels. The true teratogenicity of methimazole appears to the unclear, and its place in therapy may change in the future. So methimazole is an antithyroid medication used to treat hyperthyroidism, and is categorized within the thionamide drug class. Methimazole primarily functions by inhibiting thyroid hormone production in the thyroid glands. The drug disrupts the enzymatic process mediated by thyroid peroxidase, which iodinates tyrosine residues in thyroglobulin and prevents the synthesis of both T4 and T3 thyroid hormones. Inhibition of thyroid hormone synthesis. Central to methimazole mechanism of action is its potent inhibition of thyroperoxidase or TPO, an enzyme crucial for thyroid hormone synthesis. TPO catalyzes the iodination of tyrosine residues on thyroglobulin, leading to their subsequent coupling and the formation of T4 and T3. The thionamide structure of methimazole enables it to bind irreversibly to TPO at its active site, effectively disrupting iodination and coupling reaction. Effects on iodine uptake. Methimazole also inhibits the sodium iodine symporter, the protein responsible for transporting iodine ions into thyroid follicular cells. The dual inhibition affecting both iodine uptake and thyroid gland activity results in diminished iodination of thyroglobulin and consequently a decrease in the synthesis of T4 and T3. An additional mechanism involves the inhibition of iodotyrosyl residues during the coupling process. So methimazole may also interfere with the oxidation of the iodine ion and iodotyrosyl groups. Eventually, thyroglobulin becomes depleted, leading to a decrease in circulating thyroid hormone levels. In addition, methimazole may contribute to disease control by influencing the immune system overall functions. Several studies indicate a reduction in immune molecule over time, including intracellular adhesion molecule 1, soluble interleukin 2, and antihydrotropin receptor antibody, suggesting a potential elevation of immune-related hyperthyroid issues. However, it remains unclear whether the enhancement in the patient profile are primarily attributed to this mechanism.
Condition does methimazole treat. Methimazole treat is used to treat hyperthyroidism, a condition where the thyroid gland produces too much thyroid hormones. It is also taken before thyroid surgery or radioactive iodine therapy. This medication is sometimes prescribed for other uses. Ask your doctor or pharmacist for more information. Dosage form and strength: tablet, 5 mg and 10 mg. Hyperthyroidism: mild, 15 mg divided every 8 hours initially. Moderate is 30 to 40 mg divided 8 hours initially. Maintenance is 5 to 30 mg divided every 8 hours initially. Highlight any special instruction of methimazole. Methimazole comes a tablet and usually is taken 3 times a day. approximately every 8 hours with food. Follow the direction on your prescription label carefully, and ask your doctor or pharmacist to explain any part you do not understand. List of potential side effects and their importance of methimazole. Methimazole may cause side effects. Tell your doctor if any of these symptoms are severe or do not go away. First is skin rash, itching, abnormal hair loss, upset stomach, vomiting, and loss of taste. Mention when to seek medical help of methimazole. Methimazole is used to treat hyperthyroidism, a condition where the thyroid glands produce too much thyroid hormones. It is also used before thyroid surgery or radioactive iodine. Treatment: methimazole is an anti-thyroid medicine. It works by making it harder for body to make thyroid hormone.
For the patient tips and safety, number 1 is follow the described dosage. Take methimazole exactly as prescribed by your healthcare provider. Do not change the dosage without consulting them. Number 2 is consistent timing. Take the medication at the same time each day to maintain a consistent level in your system. The number 3 is food interaction. Some people take methimazole with food to reduce stomach upset, but follow your doctor advice on this. The number 4 is regular monitoring. Attend regular checkup and blood tests as advised by your healthcare provider to monitor thyroid function and adjust medication if needed. For the number 5 is report the side effect. If you experience any side effect such as rash, itching, fever, or unusual bleeding, notify your doctor promptly. For the number 6, avoid certain foods. Limit or avoid food high in iodine, as methimazole works by inhibiting iodine uptake. These included iodized salt, seafood, and certain dairy products. Then for the number 7, inform the healthcare provider. Make sure to inform any healthcare provider, dentist, surgeon, or etc. About your methimazole use before any procedure. And for the number 8 is the birth control consideration. If you are of childbearing age, discuss contraception methods with your doctor, as methimazole can pose risk during pregnancy. And for the number 9 is stay hydrated. Drink plenty of water to stay hydrated, especially if you experience increased sweating or other side effect. Then for the number 10 is the emergency alert. In case of severe side effect or emergency situation, wear a medical alert bracelet or carry a card indicating your use of methimazole. Then always consult your healthcare professional for personal advice based on your healthy history and specific circumstances. Adherence to your prescribed methimazole regimen is crucial for effectively managing thyroid conditions. Skipping doses or adjusting the medication without consulting your healthcare provider can lead to fluctuation in thyroid hormone levels, impacting your overall health. Safe use involves not only taking the correct dose but also following the specific guidelines. Number 1 is consistent adherence. Take the methimazole consistently at the prescribed time. Missing dosage can disrupt the stabilization of thyroid level. Number 2 is the open communication. Keep an open line of communication with your healthcare provider. If you are experiencing side effect or have a concern, don't hesitate to discuss them. The number 3 is the regular monitoring. attend scheduled checkups and blood tests, monitor your thyroid functions, allows for timely adjustment to the medication if necessary. The number 4 is education. Understand the importance of methimazole in managing your thyroid condition. Knowledge empower you to make informed decision about your health. For the number 5 is the side effect awareness. Be vigilant about potential side effect. Report any unusual symptoms promptly to your healthcare provider for evaluation. Then for the number 6, avoid self-adjustment. Do not adjust the dosage or stop taking methimazole without consulting your doctor. Sudden change can lead to thyroid imbalances. Then to follow dietary guidelines. Recommendation, especially regarding iodine-rich foods, maintaining a balanced diet support the effectiveness of the medication. In pregnancy planning, if you are of childbearing age, discuss family planning with your healthcare provider. Methimazole can have implication during pregnancy, and planned approach is essential. Then, remember, your healthcare providers is usually ally in managing your thyroid condition. Adherence and set use contribute significantly to the success of your treatment plan. Conclusion and call to the action. For personal guidance on your health journey, always consult healthcare professionals. Their expertise ensure tailored advice aligned with your unique needs and conditions, fostering the most effective and safe outcomes for your well-being.